Floyd's of Leadville has been a terrific sponsor. Now in their second season supporting this show. We love using and taking their products, but occasionally, Fatty, we get them to do the work for us.
Yeah, we love to get other people to do our jobs. It says something about a couple of guys who talk for work. The Floyd's team has plenty of experience with rest and recovery, including that of a former World Tour pro and wearer of the yellow jersey, Mr. Dave Zabriskie. So Dave, what is the Floyd's of Leadville product you use most and why?
Yeah, for me, I'll use the topical cream, the transdermal cream. Just seems to work the best on my neck. I've developed sore neck over the years, all that weird positioning. So I'll just rub some of that on when it hurts, and it goes away probably within 30 minutes.
I use the warming balm for kind of the same reason, but more for the, I use it on my Achilles, for my right Achilles tendon, which is just, I'm old, I'm stiff, I've had multiple injuries, and usually it takes me half an hour to get, warmed up for a ride. I put that on a few minutes before, and I do okay. I'm able to get into the flow of the ride a lot faster. So grab yourself some transdermal cream, the kind that Dave loves, or use the warming balm that I go for at floydsofleadville.com and use the code FATTY at checkout for a 15% discount on all your orders.
And thanks, Floyd's of Leadville, for sponsoring the show.
3, 2, 1.
Leadville, the podcast for the 100-mile mountain bike race presented by Floyd's of Leadville. It's season 3, episode 10 of the show that breaks down, builds you up, gets you ready, freaks you out for the highest and hardest one-day mountain bike race in the country. I'm Michael Hottie, or Hottie if you prefer.
I do prefer, and I am Eldon Nelson, known to a lot of you as Fatty. And I'll have to say, Hottie, the reaction by racers to the cancellation of the Leadville 100 has been really way more than understanding. Of course, we all wanted to race, and many of us were holding out hope for a 2020 start, but we get it. And that is another reason I am proud to line up with them on 6th and Harrison. But, the fight goes on in Leadville, and they've got to keep that community healthy. So in this episode, we will meet the people who are leading that fight. Not only are they medical professionals, but they are people who love and live in Leadville, and they enjoy Leadville outdoors life. In fact, one of our guests, besides being an ER doctor in Leadville, is also a 6-time sub-9 Leadville 100 finisher.
Yeah, looking forward to hearing from both of them. Now, speaking of cancellations, this show follows what was Deferral Day for many of you, and it seems like deferral has been a theme for Lifetime for all of 2020. First was the lottery trouble, or the lottery debacle, as it was called by their marketing person in January, and then the COVID-19 issues. So on Monday, this past Monday, as we're recording here, at 5 p.m. Mountain Time, Lifetime opened up registration accounts, and racers literally raced to their keyboards to ensure they locked in their primary option. And there were several. You probably know them by now. Now, earlier in the week, Fatty, a little poll was conducted on the participants page, on that Facebook participants page, asking racers what option they were going to go for. About 100 responded, and about 75% said they wanted to race in 2021, whether that be through the straight deferral or to donate and then guarantee that second option. So both offered a 2021 race date to them, those two deferral options. Now, you don't have to be good at math to know there is no way, after Lifetime had already gotten people to switch due to the marketing, the so-called lottery debacle, that there would be enough room for 75% of the remaining 2020 field to get into the 2021 race. And indeed, that was the case. And people have expressed their frustrations. In addition, the 6-step process was confusing for some as they went through that deferral process. So the question of the week is for you, Fatty. How was your deferral experience?
I would say in most ways, it was the same as everyone who was rushing to their keyboard. Maybe it was different in a couple of small ways. First off, I enter the race the same way everyone else does, via the lottery. People should know I pay full price. I have never been comped or given a discount on that. And so for the deferral process, I didn't ask for and was not offered any special treatment. Now, Lisa's a nurse. My wife is a nurse at a hospital here, and she was working when the deferral happened. So I needed to take care of both her deferral and mine at the same time because I didn't want, and I don't know whether for sure it works this way, but I didn't want me to get in 21 and her to get in 2022, right? That would be a mess. And this upcoming year in 2021, she and I are going to have 3 kids in college. And money's going to be tight. So we needed to go to the deferral option. I plan to donate some money to the Leadville Legacy Foundation, but I cannot afford $1,000 worth of donations to the Legacy Foundation at this moment. So, and of course, that's in spite of the vast amount of money you and I make from this podcast.
Yeah, huge money.
Huge money. So I set an alarm to 4:45. I got my stepson Blake to log in to run sign up on one computer as his mom, while I logged into my computer as me. And we're sitting side by side, and we find the race registration for Lisa, find the race registration for me, and at 5 p.m., it really is starting to sound like a race here, huh? So we start clicking around the site, trying to figure out the kind of vague instructions that Lifetime had provided on their FAQ page. And we are just looking for any page that has the word questions as a link at the top, which is a weird thing to label a cancellations deferral link, but whatever. So within 2 minutes, Blake saw that questions link on the registration management page for the race, and it's at the top of the screen. He directs me to it, and I swear, Hottie, it felt like he and I had just won a scavenger hunt. We're like high five. We select the deferral option, select the 2021 option, save, and we are done and out by 5:04 p.m. And then now Lisa and I wait because there is no confirmation email. And I assume that's because Lifetime needs to do some figuring and selecting on their side. But we are assuming, at least for now, that we are going to be racing in 2021. So fingers crossed, and we'll let you know what we know when we know it.
Yeah, that was one of the confusing points for people afterwards, is the fact that they did not get a confirmation email. But I did see some stuff out of Lifetime that said, don't worry, it's coming. They'll be there. They'll have something as soon as they get all their data collected, and they'll send out to the folks who deferred and confirm they are in the race that they did so, or they deferred to the other day. By the way, not all of Lifetime mountain bike events have been postponed or canceled. I reached out to the organizers of the Tahoe Trail 100. These are the same folks who put on the Austin Rattler and Wilmington Whiteface, both of which are postponed, by the way. And I was told that the registration for the Tahoe qualifier on July 11th is still on. Now, there's probably no coins there, but as of right now, and folks, I want you to be sure that you go and double check Hottie's work here, because obviously we're recording this podcast, so anything can happen between recording time and when you hear it. But as of the time of this recording, the July 11th Tahoe Trail date is still on. The organizers said they will make an announcement no later than June 1st as to whether they are go or no go. So again, please double check what you are hearing here. Again, as of this recording, California itself is reopening. The governor has said sports could return by June, and North Star, where the Tahoe Trail is held, is also keeping open the possibility that they will have activities this summer.
Hottie, I am starting to get accustomed to the probability that this is going to be a year without many, if any, big races.
Yeah, but there's a big difference here with no big races and no big rides.
Yeah.
There's the Rebecca's Giddy Up Challenge this weekend, for example. We talked about that last episode.
Yeah, it's absolutely true. And I've got 16,000 feet of climbing I am committed to this weekend based on that. And I actually want to talk about an experiment I conducted last weekend as I was doing a 10,000 foot of climbing day.
Here we go. Fatty experiment?
Yes, an experiment. I'm my own guinea pig. The experiment was, how would I feel if I did a big 9-hour, 10,000 feet of climbing, all single track day all on a single speed, using nothing but Morton 320 as my fuel and hydration source.
9 hours, just the Morton 320. Okay, how'd it go?
Way better than I expected, honestly. The ride was the ride I was on, it had a few drinking fountains in a few places, so I didn't even have to carry it all with a Camelback or anything like that. I just carried 8 packets of the Martin 320 powder, and that's always, of course, pre-measured, and it was a cool day, so by filling up every couple of hours and drinking a bottle of an hour, I was able to get 320 calories an hour, and hence the name, and that's all the hydration I need too. So I had no sore gut. My energy didn't flag. I didn't need to remind myself to tear open a gel every half hour. Honestly, I feel like I have kind of hacked the system here. I didn't have to worry about food. I just drank at the levels I do anyway, and I had great power all day. So I don't know if that was a fluke. I've never gone with just liquid calories before, and maybe it'll blow up in my face when I try it again for the Giddy Up challenge. But I'm going to try it, and it's kind of an interesting, like I say, experiment. I'm interested to tell you more about that when I learn more.
All right. If our listeners would like to try a similar experiment, you can get Morton products or anything at the feed at a 15% discount by signing up at thefeed.com/Leadville.
Yeah, and I'm just going to say this is the year you can try something crazy, right? You mix up your routine, experiment with new or different nutrition without worrying about it sabotaging your training day for an important race, because you probably don't have an important race coming up right now. So, maybe give an all Martin day workout a shot. See how you feel. It might be a game changer for you. I'm kind of thinking it might be for me. And the feed can help you and can get you a good price on everything they sell by signing up at the same URL that Hottie just gave you, thefeed.com/Leadville.
Yeah, I think Rebecca Rush, in fact, suggested the same thing when she was talking about her Giddy Up challenge. It's a good opportunity, the Giddy Up that is, to try things. Go ahead, try a different take on how you fuel yourself, for instance. So, Fatty, did you mix anything else up in your big ride last weekend?
Yeah, it was actually a full day of experimenting, including a new bike. And I'm not going to go into the new bike too much right now because I want to do a full episode on it. I've got a new single speed, and I still have a couple of little parts that I want to switch on to it where I am going to consider it final. But one thing that I have not yet done, and I'm very excited for, is I've got a new bar and stem combo.
Yeah, but you've been a 100 mil NV stem and MS bar combo guy on all your bikes for about, a half decade now?
Yeah, I have been a 100 millimeter stem guy, M5 bar guy for a long time. But it's, like I say, a year for trying something new. So instead of the M5 bar, I'm going to try putting an M6 mountain handlebar on my new bike. Main reason is instead of it being 760 millimeters wide, which is pretty wide for a bar, it's 780. So, a centimeter on each side of extra. And I'm expecting good things on my single speed from that extra leverage that new 20 millimeters gets me. And I'm getting the version of the M6 bar. You can get it flat or you can get it with a rise. I'm getting the one with the 25 millimeter rise. I'm getting a slightly shorter stem than I'm used to. And specifically, I'm asking for the 85 millimeter M6 stem. And you can set that up, flip it so it's either plus degrees or flip it so it's minus 6 degrees, which means I can experiment with the height a little bit on this thing. So between the little wider when I row and have my bar up a little bit, I'm expecting there's going to be less of me bending forward for the standing climbs and a little bit less weight on my wrist when I'm riding in the saddle.
Oh, you won't want to thread that bar through tight forested single track, though.
No, I will not. 780 is not a tight, twisty single track in aspen trees kind of bar. But the nice thing about NV bars is, if it turns out this M6 is just too wide for me, they've got the bars marked on both sides. It's really easy, and even I can do it. You can shave down a few millimeters, and that is, in fact, what I've done with Lisa's M5 bar.
Wide, narrow, flat rise, Envy's got you covered for a great bike fit and confidence of the best carbon components in cycling. Check out that M6 bar and stem and the rest of their components at Enve. That's ENVE.com. You could be forgiven if you could not point out where Leadville's hospital is. Racers go by it in a flash shortly after that start. You probably, though, have a better chance at catching a glimpse of St. Vincent's on the way back to the finish line. It's on your right. Just after that is you turn right onto 6th Street, pretty close to the high school. But it's small, and it's pretty easy to miss. It's the place you'd probably end up were you to get injured during the Leadville Trail 100.
Yeah, small is really the main point here. St. Vincent's is not unlike what you'd find in most rural communities, but in spite of its size, it has been tasked with a big job this year, trying to keep the city of Leadville healthy in the middle of a pandemic. You all know by now, of course, that Leadville 100 has been canceled. The Board of County Commissioners making that call in part due to the input from local health providers, primarily the physicians at St. Vincent's. So Hottie and I thought it would be a good idea to hear from two of them about what Leadville is up against with this virus and why they thought it was the right move to shut down Leadville's summer events. Dr. Lisa Zwerdlinger and Dr. Dylan Luyten, both working at St. Vincent's Hospital, and we'll go into a little bit more details, but thank you so much for joining us today.
My pleasure.
Absolutely.
So let's start with you, Dr. Lisa. I'm going to call you what everyone calls you in Leadville, but you're the Chief Medical Officer at St. Vincent's Hospital, Public Health Medical Officer for Lake County, and you also are the owner of Rocky Mountain Family Practice in Leadville. So your roots run pretty deep in Leadville. Are you from Leadville?
No, sir. I grew up close to Leadville, just on the other side of Mosquito Pass. But I've been in Leadville proper since the late 90s.
Wow. So tell us, what brought you to Leadville? Why did you choose that as home?
Well, I'm an avid ice climber. I also like to backcountry ski. I also mountain bike. And there's no better place in the world to do that than here.
I would not even dare to disagree with you. An ice climber?
Yes, sir.
That's awesome. Is there great ice climbing in Leadville? I assume, considering the winters there is.
Yeah, there is. The Coolars, the back Coolars of Massive are probably the best mixed mountaineering climbing that I've ever done.
So obviously, we've got a couple of doctors who are real athletes here. And I want to ask you, Dr. Luyten, Dr. Dylan Luyten, you are a medical director of emergency services, Swedish Medical Center in Inglewood, as well as an emergency physician at St. Vincent's. And I know that you are a multi-time sub-9 finisher in the Leadville 100, right?
Yes, I've been very fortunate, probably with in terms of technical stuff. And yeah, I've managed to do 6 out of 6 sub-9s. So very, probably more lucky than anything else.
Luck for sure can be part of it, but it's luck favors the prepared, as they say. So, and you split your time between Inglewood and Leadville, but you live at least part of the time in Leadville. Why did you choose Leadville?
So I've been coming to Leadville on and off since I was a kid for camping trips and things like that. And about 8 years ago, my wife and I were looking for a second home in the mountains. Our free time revolves around mountain activities, whether it's hiking or skiing or mountain biking or what have you. And we looked all over the state and realized a couple things. One, we really didn't want to be in a ski resort town for several reasons. Two, we really wanted to be in a town where we could walk to coffee and restaurants and shops and have a community that we could really become a part of. And we're absolutely charmed by Leadville. And honestly, my wife's first real exposure to it was during one of the Leadville 100 races, the first one I did, which I think was in 2011 or 12. And she had a lot of time on her hands while I was out on the course and was walking around town and marveling at the beautiful Victorians and just the charming nature of the community, and we were smitten.
I hear 1,000% what you were saying as someone who has dreamt of being able to live in the town, just haven't ever had the way to make that work from a job perspective yet. So you both clearly love the town, and you're both medical professionals in the town working at the hospital. And I think, Dr. Lisa, you in particular were a real part of the debate and decision eventually to have Leadville not have the race this year. I was hoping you could just sort of tell us the story of what happened and why and what brought that decision about.
Well, like I said before, the governor made that decision for us through the Colorado Department of Public Health and Environment and the governor's mandate. We are unable to gather in groups of greater than 10 folks now. And even as we did the math in our heads, and if everything went directly as planned, a group of greater than 250 would not be allowed even throughout the rest of the summer. And so all of the large events that are scheduled in Leadville withdrew their applications, knowing that they would not be able to, decrease the number of participants. And so the decision was really made for us by the governor of Colorado and the Colorado Department of Public Health and Environment.
Dr. Lisa, I think, first of all, congratulations may be in order in the fact that you folks there have done a pretty terrific job with coronavirus and your caseload. I mean, by all accounts, your numbers are nice and low, and they've been manageable. And as of this recording, Lake County has not recorded a COVID-19 related death. That's pretty amazing. Has your approach been any different than any of your other counties in Colorado? Have you been lucky? Have you been good? Have you been all of the above? Explain how you've had success so far with managing what's been a terrible problem nationwide.
Yeah, thank you for recognizing that. We're very proud as Leadvillians what we've been able to accomplish. And what's even more interesting is that through the stay-at-home order, and now a little over 2 weeks into the safer at-home order, we have not had a reported case of COVID-19 here in almost 2 weeks. So we have done an excellent job at socially isolating, wearing our face coverings, washing our hands. And I think that there are a couple things that make that able to happen here in Leadville. One, you have to be pretty hardy to live up here. And I think that just by natural selection to live and thrive at 10,000 feet, you're overall, healthier. Your heart and your lungs are certainly in better condition than in other places, I think, on average. Two, we have lots of open space, and it is easier to socially distance here than it is, I think, in other areas because we have lots of places to go where we can be 6 feet from our neighbors and not congregate in large groups. But, most importantly, I think that we have a very well integrated healthcare system where the hospital works very closely with the public health department, who works very closely with the primary care providers here. And we have an excellent way to gather data and communicate. And I think all of those things have made us very fortunate as we combat this pandemic.
Dr. Dillon, why don't you give us a picture of what it looks like in St. Vincent's, especially through the pandemic here? How's it been inside the hospital? What's been the attitude in there? What kind of feedback have you received from the community too, as you have tried to stress to them the importance of, keeping this pandemic as best possible at arm's length?
Well, I think that the community has taken this very, very seriously, and a lot of it has been a function of very clear communication from Dr. Lisa and her team. Certainly within the hospital, there have not been any shortages of PPE. The protective equipment that the healthcare providers need has been in good supply. I think spirits have been high because of this. People feel safe working there and feel like the risk to healthcare workers has been mitigated as well as it can possibly be. And with that, and relatively low, volumes of COVID-19 patients, it's been extremely manageable. I find St. Vincent to be a really pleasant place to come and work. It's a really nice respite sometimes from my practice in the city in Denver, and I'm very impressed with the whole hospital's response. It's extreme. I think Lisa put her finger on it. Really, just extremely well coordinated, and there is not a feeling of chaos or disarray that sometimes people might be hearing about in the media.
So you obviously have a lot to be proud of. I'm wondering if it's possible for you to give us an analysis of what you think may have been the result of the Leadville 100 races, the mountain bike race and the running race, if they had gone on as originally planned.
The bottom line is that there would be no way to prevent transmission of COVID-19 at the race. That's, I think, important to say at baseline. All efforts could be made to mitigate some of the exposure, but the reality is there's no way that you could either test everyone who was coming, let alone test spectators and family members and support crew. The nature of the race is such that although the course is massive and long in time, you would inevitably be shoulder to shoulder with people for large portions of the competition. We also know from analyses of the viral shedding and aerosolization of particulate matter behind a cyclist that the idea that 6 feet of distance is protective between cyclists is simply not true. The increased respiratory rate, all elements of the efforts involved with cycling are such that there's just this vast cloud of droplet material and respiratory droplets that fan out behind a cyclist. So there's no way that you could possibly prevent exposure. The truth is that there is relatively low risk of adverse outcomes for healthy, relatively young people with COVID-19. So ultimately, I would be less worried about the health impact on the racers than I would be about the health impact on the community. As Dr. Lisa has talked about, this is a small community that's close, and while Hottie for sure certainly has its share of vulnerable patients and population, and what I would be most concerned with would just be the introduction of more coronavirus into this community and the impact that would have on the citizens here. I think that just simply couldn't be prevented.
Yeah. And Dr. Lisa, maybe we can get you to talk a little bit more about that. What would the race bring, not necessarily to the racers, the volunteers, the people who are, who essentially volunteered themselves into this situation, but to the community, the residents of Leadville? What would the impact have been?
Right. Well, it's exactly, I think, as Dr. Luyten has just explained, that with everybody, there comes a chance for exposure. And so our vulnerable population would have been exposed to far more individuals who potentially would have been infectious that would have gotten them sick.
Tell me a little bit about, without specifics necessarily of your patients, but what is the typical Leadvillian? Are the demographics that it is primarily young, primarily older, what is there any particularly different demographic that makes them more or less susceptible to symptoms?
It's a good question. We don't have a lot of that population-based data. It's not something that's ever been collected, at least not in large segments of the population. But just from my experience, it is true. We are, I think, a little healthier than other populations. We definitely have less obesity than other parts of the country. And then, certainly by natural selection, if you had advanced heart disease or lung disease, it's difficult to thrive here. So those populations usually don't stay, or at least, are not here for long. But I think that Leadville looks a lot like the rest of Colorado, in that we have generally healthier populations, but we do have our share of vulnerable. We have our share of elderly patients, being treated for a serious illness that depresses their immune system. So we are definitely with a population that is at risk also.
One thing I would add to that that I think is important to remember as well is that obviously Leadville's at over 10,000 feet. And while in New York City, a oxygen saturation reading of 95 to 99% would be normal. It's really pretty normal for folks in Leadville to be feeling completely well and be hanging out at 88 or 89 or 90%, which would be considered very hypoxemic at sea level. And so people are kind of living with, if you will, this sort of mild silent hypoxia up here. And we know that part of the presentation of coronavirus is this silent hypoxia. And once folks are down under 80%, say, you really begin to see end organ injury. So that has that's starting to injure the heart and the liver and the kidneys and the gut and other organs. And so the margin that somebody living in Leadville has for error, if you will, is less. So, Leadville's a hardy population. It also is a population that's very self-sufficient and kind of folks, my experience here is folks kind of stay at home on a good day until they're really crashing and falling apart. And that's not a great thing for folks who are hypoxic. And so I would just be worried that the physiologic reserve of someone in Leadville is less by virtue of the altitude than it is elsewhere. And this, as I said, is not a population that runs in with a sprained ankle. We see people coming in with, florid septic shock, late presentations of heart attacks, on death's door from their ruptured appendix on a normal day.
And they were just planning to walk it off.
Yeah, they're going to walk it off. And these folks are at especially high risk up here.
Yeah, the toughness that is normally a real virtue and one of the great characteristics of the folks of Leadville, in this case, could be something that doesn't bring them to you until more damage has been done than is easy to treat.
That's right. I mean, what we've seen in the city of Denver, and it's playing out across the country, is an overall reduction in the rate of people accessing the 911 system and then emergency departments in general. And with that, a lot of delayed presentations of serious non-COVID related illnesses like heart attacks and strokes and diabetic emergencies and things. And within our own, in the city and county of Denver, we've seen a doubling of the rate of out-of-hospital cardiac arrest and anecdotally, more than doubling of the rates of folks just simply dying at home. And the psychologic burden of our EMS systems of responding to so many dead and dying people is something that we'll be looking at for years to come. And we just simply know that there's a lot that folks who have chronic illness are we don't even know the rate of harm that's been done there. It's enormous.
Right. So again, like we said, folks, congrats to both doctors here, Dr. Dillon, Dr. Lisa, flattening the curve. I think you've done more than that in Lake County and Leadville with the number of infections. And again, to date, no deaths, no COVID-19 related deaths in Lake County, which is just terrific news. I sense, though, for both Dr. Dillon, Dr. Lisa, specifically to you, Dr. Lisa, that people still want to come to Leadville, specifically this summer, even though the events have been canceled. So if somebody still has plans to come to Leadville, what is your message to them?
Please be careful. Remember that what you leave behind is not only footprints. Sometimes you leave infectious agents behind as well. And I would just encourage people to please remember to socially distance. Make sure you're washing your hands, you're staying 6 feet away from your cohorts, you're wearing your face coverings. And just know that we have limited resources here. So if we were to get large groups of people who became sick while they were here, we would have limited resource to be able to take care of them. And you have to remember that anytime you leave large metropolitan area that has more resource than we do.
Yeah, Dr. Dillon, what happens if somebody does get sick in Leadville, or if you get two people, say, sick with COVID-19? What's gonna happen to them?
Well, we can certainly care for folks with COVID-19 at St. Vincent. We have a protocol for kind of what we consider the maximum safe amount of supplemental oxygen that we're comfortable using on the floor there. We don't have the resources of an intensive care unit. So if a patient was not able to breathe for themselves and required mechanical ventilation, i.e. a ventilator, then we would transfer those people. We have a ventilator or ventilators there, and we certainly have the resources to manage those problems, but those folks would be transferred to Denver. Currently, we have plenty of critical care resources in the state of Colorado because the story has been one of, as you say, a flattened curve. And it remains to be seen whether we're going to have a second wave or waves of cases. But luckily, we've had plenty of resources. We can care for people with COVID at St. Vincent, both in and outpatient. But if you're critically ill, you're going to be transferred, and that's true of any critical illness.
Dr. Lisa, though, what would be your capacity at St. Vincent? How many could you handle, and at what point would you become impacted?
Yeah, that's a great question. And we've been having that discussion for a couple of weeks now. So, I mean, if you do simple math in your head, there's a certain period of time that it takes when receiving a critically ill patient, how long it takes to stabilize them, get them back, get them to Denver, and then have the transfer crew come back. And so we're all estimating that's, 6 to 8 hours. And so if we're able to accept, 3 to 4 critically ill patients per day, and they're kind enough to spread themselves out, we would be fine, and we would be able to continue that pace as long as Denver is still accepting patients. However, as you can imagine, if all 4 of those people came in at once, our system would be overwhelmed, and it would be difficult to manage those. And so again, keeping in mind that if you come to Leadville to enjoy what we all do here, you need to keep in mind, you're well now, will you be well later? And then what happens if you're not?
Which gets me back to, you probably just answered my question. And the thing I've been saying here, Fatty, is that they've been doing great, right? Lake County's doing great. And hey, why not put on a race? They've been handling this virus great. Apparently there's no spread, there's no problem. But that is the problem, correct, Dr. Lisa, that if something starts to happen in Leadville or Lake County, it's going to pile up on you quickly.
Yes, sir. And I think that's true for every community, but especially those small rural places that just don't have the medical infrastructure.
I wonder, maybe looking a little bit further into the future, how is the coronavirus going to affect the Leadville community and the Leadville race in 2021, 2022? Is the way we race going to change forever, at least from your perspective?
I think that we'll be living with the anxiety around large group gatherings, and I think we'll see spontaneous adoption of some masking and some changed behaviors in terms of social distancing for a long time to come, independent of what public health guidelines are. I think the communities everywhere is frankly emotionally traumatized by this whole experience, and that's going to have an impact on people's behavior for a long time to come. However, I don't see, in my opinion, I don't think we'll see racers racing much differently. There may be a little reluctance to join into a very large event initially, but my gut is humans have flocked together and done this for a very long time. And my gut is that ultimately we'll be back to racing in the same way. Maybe not the spectating in the same way, but racing in the same way. Of course, this is all speculation. But it is kind of how I'm thinking about it.
Well, and I also think that once we have a vaccine and effective treatments, that will also be a game changer.
Yeah, that's an excellent point. That's right. Boy, I can't ride my bike with a mask. I'll tell you that much. I just no way. It's a non-starter.
Certainly not at 10,000 feet. At least not very well.
Yeah, it's a non-starter. I can barely walk across my own ER with a mask on. So there's no way I'm racing with one.
I was thinking actually that I might today try putting on a mask and leaving it on for the entire ride. I don't know about most racers or riders, but leave alone the eating and drinking part of riding. I sweat heavily, and my nose tends to run when I'm riding. My mask is going to be, it's going to be a disaster zone. And so, hopefully we won't always need those.
Well, Fatty, I think there's a whole new category here for us, the N95 category.
Oh,
in
yeah.
Leadville. Now, come on. Get you up for the challenge.
That's true. It's like the equivalent of riding a single speed fat bike. That used to be the mark of extreme toughness. Now it's, did you ride with a surgical mask or did you just go all the way to a full N95? In which case, yeah, it's hilarious.
Dr. Lisa, while we have you here, I'd love to borrow a little expertise. Now, for athletes who are thinking about their personal health and whether or not they are more susceptible to virus in general, obviously coronavirus is the big deal, but virus in general, what should we be thinking about as athletes? Like we exercise hard, we're obviously punishing ourselves, we're really causing injury to ourselves and then recovering. What's different about an athlete's immune system compared to maybe somebody who's more sedentary?
Well, if I might say, and I, of course, will say this to anybody that will ever listen to me, it's the way that we take care of ourselves. And so athletes, hopefully as a population, generally take better care of themselves. But for all of those teenagers out there, stop vaping, don't smoke, and make sure that you lay off on, a poor diet. But you definitely know that people who are in better health in general definitely do better in many ways. They're better athletes. They perform better. They certainly have longer, healthier lives. And the same is true about the coronavirus infections as well, as they will have less illness, even though they become infected.
I'd like to finish with asking you for your ask. What would you ask of folks like us, like Hottie and me, and the thousands of people who love to come to Leadville, love to race it? And what would you like us to do in order to help the community of Leadville? And as residents of Leadville, what would you like to say to people like us?
Well, that's an easy answer. Please continue to take care of us by staying away for now. We love certainly the Leadville Trail 100 and all that it's brought to Leadville. And boy, economically, certainly as a business owner, August is my best month. I ride that wave for a long time during the year. But right now, please stay away. It's important that we keep our handle on this and that we will certainly be healthy and happy and ready to go in the future. But now is not the time to come.
Anything you'd like to add to that, Dr. Luyten?
I would add that the Leadville Racers website has some nice links for portals to make donations to the community of Leadville. And we're fortunate, many of us anyway, who participate in these endurance events to have some disposable income. And I hope that people will view the opportunity of not racing as a chance to give back to the community. Leadville has given us so much, and we should take this opportunity to view the cancellation of the race not as something that's harmful to us, but an opportunity to really give back to the town in a selfless way. We'll be back. We'll be racing here again. The town is resilient, and it's unique, and people will be drawn here, hopefully forever. And please just give back to the community.
Thanks again to Drs. Zwerdlinger and Luyten for sharing their thinking behind what was a very difficult decision. Fatty, I followed up with Dr. Lisa on the question of visiting Leadville. I just wanted to make sure we were clear on the message because we asked her twice during the interview. And the message is from Dr. Lisa, don't go to Leadville now, meaning this spring. As summer approaches and you are considering a trip to Leadville, if you are, check first and make sure health providers have given clearance. And if things are open, Dr. Lisa says, expect that social distancing will be the rule.
Yep, that's good guidance, Hottie. And for the latest on the health situation in Lake County and in Leadville, you can go to lakecountyco.com/health. And you can also go to LeadvilleTwinLakes.com. And you can always get the latest on what is open in that area. Hottie, my wife is becoming a snob.
Who, Lisa the Hammer? A snob? No.
Well, only for bikes. And it's a really recent phenomenon. She used to just ride whatever I gave her and claimed she could not tell the difference between anything on anything. But you know that this year she's been riding a bike with Shimano XTR, and it has ruined her for everything else forever. Yesterday, she was riding her single speed, which is an older bike with a variety, sort of a junkyard of older components. And about midway through, she stopped. I mean, she literally stopped and said, I cannot ride this bike anymore until you put Shimano brakes on it.
Had you switched them out or something?
No. They're the same brakes that she has had on that bike for years. The thing is, until now, she's always had brakes that are on the same scale of okayness, more or less. Now she's gotten used to Shimano XTR on her best bike. And now you can just say that I've made a pretty decent sized order for some new brakes for more than one bike for her.
Sounds like a new slogan here for Shimano. Good enough that people who can't tell can tell.
Yeah, we'll send that into Shimano marketing right away. But seriously, I personally have had the same reaction. Once you've used Shimano brakes, whether they are XT or XTR, plan on making the switch across the board because you are not going to want to go back to whatever you were using before.
Yeah, so if you're ready to put that to the test, check out Shimano's brakes and other components at bike.shimano.com.
Hottie, speaking of riding with wives, I saw a picture of you and Mrs. Hottie the other day out riding with face coverings on.
Yeah, we both had those buffs, those neck gaiters that can easily be pulled up and cover mouth and nose areas. And the fact that we are wearing those brings up a bit of a dilemma that we're seeing here in the LA area, and that is whether you need to wear a mask when out exercising. Now, a few days prior to that photo, Fatty, the mayor of Los Angeles, Eric Garcetti, announced that everyone out in public has to have a face mask, and in most cases, wear that face mask. And here's how he laid it out.
We're requiring all Angelenos, except for small children or those with disabilities that might be harmed by a face mask, to wear a face covering when they are near others who do not live in your own household. Simply put, bring your mask with you whenever you leave the home. You never know when you're going to bump into somebody round a corner in a park and see somebody. Have your mask with you when you leave your house. And as long as you're not doing a solitary activity or with your own household, put that mask on, always now, and that is a requirement. In those rare moments where you're somebody who could never physically run into somebody else and you're just jogging by yourself, maybe you can get away with not having that on, but have it with you just in case, and that is now that order moving forward.
Now, up on the trails, I saw the mayor's face mask mandate getting mixed results.
Yeah. Now, I've seen your trails, Hottie, and let me just say they are a little bit wider than the freeways we have here in Utah. They are mostly wide, fire roads, and they can be pretty busy. So you're not taking solitary trips down single track there.
You're right. I mean, we have single track, but there are hundreds of miles of mixed-use fire roads connecting those smaller trails. And it was on those larger trails where we saw some people with masks on, some without masks, and some pulling them on as they passed by others. Now, Fatty, I'm not here to call out anyone on this. Mrs. Hottie and I took our best shot at what we thought the mayor was trying to get people to do. We pulled up our buffs as we encountered people, and when it was just the two of us, we would pull them down and ride as normal. Now, we weren't bothered either when we saw hikers and other riders who wore no face coverings at all, and we did not hear anyone calling anyone out, like a trail user not having a mask and being called out, which is been going on a little bit around here. There is shaming, I should say, Our trails have been closed through most of this pandemic, so it was great just being back on them. Is it weird to be riding with your air intake covered up? Yeah, but whatever. I'll wear it if it means I can resume some normal kind of riding.
Oh, I hear you. I mean, the being on the bike is the main thing, and we make accommodations so that we can, right? I think that you are doing it just right. You are being considerate to others. You're being safe for them and for yourselves. and you are still getting as much fresh air as you can. And since summer is coming fast, so the heat and breathing issues are going to be even trickier on bikes this year. So, get out, ride while you can, do what you can, breathe as much as you can. But as far as I know, and there is no summer-specific, bike-specific mask out there, which is too bad, and something that's probably a good product opportunity for someone. But our partner DNA Cycling has some great jerseys that you are going to love as it heats up in California and here in Utah and anywhere else people are, that you're just going to love for your outside rides. Go to dnacycling.com, and in addition to the custom apparel options that we've been talking about that you're going to see, you'll find some incredibly good-looking kits that are just so great for summer, Hottie. I'm going to be in particular recommending you browse on over to the Many Moons jersey design. It is beautiful, and it is also a thin, comfortable wicking mesh. It weighs and feels like, and I'm not exaggerating here, like it is practically nothing. You can fold it up into your fist.
Mm-hmm. And their BioFit jerseys fit close as well, Fatty, which means these are efficient and, most importantly, to our friend Josh Portner over at Marginal Gains, they're aerodynamic. Josh, owner of Silka and co-host of the Marginal Gains podcast, has pointed out a close, non-close, as in close to your skin, non-flapping jersey is one of the easiest and most meaningful ways you can get free performance advantages.
Yep. Light, cool, and aero. Win, win, win. Check out the Many Moons and other BioFit jerseys at dnacycling.com.
All right, just before we say goodbye here, I'm sure many of you follow Nino Schurter, and why wouldn't you? He's won mountain bike worlds 8 times, 7 World Cups, and he has a gold medal to boot. Now, if you watch Nino's videos, you may have heard something very familiar in a recent one.
Today, we are going to do some HIIT training, a high-intensity training.
Fatty, news alert. Nino stole the closing theme for the Leadville 100 Mountain Bike Podcast, and he's never done Leadville.
I thought I recognized that from somewhere. I am shocked. Shocked, I tell you, and appalled. Without words. There is only one way Nino can make this good, and that is 2021 or 2, commit to racing at the Leadville Trail 100.
Agreed. And if he did, there's no doubt he would have the fitness. You see, the video where he stole our closing theme covers Nino's intervals. The workout in particular is designed to raise his VO2 max, the one in this video. This is the zone just above your FTP, so really hard.
Yeah.
And near the end of the video, Nino reveals just how hard he goes in this very hard zone.
To give you an idea of my numbers, we do those VO2 max intervals now in between 420 to 470 watts. That always depends how heavy you are, where your threshold are, where your VO2 max is. But that's where I'm doing those intervals. I'm 67 kilograms heavy, and I did in average around 440 to 450. Those 6 times 5 minutes.
Yeah, that's right. He said 400 to 450 watts for almost 5 minutes, and he repeats that 6 times.
Oh, man. Ouch. Okay, Leadvilleans, back to your training. You've got to get your VO2 max up to 450, right? So remember, in reality, you are not Nino. You are you, and we will see you at the starting line in 2021. And in the meantime, enjoy our closing theme.